Hello guys, Dr. Carlo here, board certified emergency physician with DrER.tv. So I hope you guys are not getting bored with my paracentesis. They're pretty simple procedures. They're very satisfying. This is a whole different patient. She has liver cirrhosis secondary to previous alcohol abuse. She presents to the emergency department almost exactly 2 weeks after having it drained by me in the emergency department. Technically not an emergency procedure. She's not in distress. She doesn't have a fever. We don't think it's an infection, but she's very uncomfortable because the belly is so big. It's actually causing some pressure and difficulty breathing. So just to be nice and to give her some comfort, and because she doesn't have the adequate follow-up care to get it done and get it scheduled and everything, we decided to go ahead and do it. On top of that, I had a nurse practitioner student working with me, Miss Star, who had seen me do it 2 weeks ago with the same patient. So it's perfect because see one, do one, teach one. And as you can see, she did the procedure and we managed to get up to 5 and something liters of fluid from her belly. Many thanks to the patients for letting us record it and share it with you. And I hope you don't think it's boring seeing another one of these. But there's a lot of conversation happened during the procedure and after, and I think it's always worth learning some more. Take care.
Her bowels?
Correct. So the black space in that ultrasound, that's fluid. And what you want to see is that you're finding a pocket that has the biggest amount of blackness in it. So usually, think about it this way, gravity, right?
Mm-hmm.
So if you go further down and further this way, you usually get a big pocket of where all that fluid is. There. That would be my spot right there. Look at all the space that you have between the skin and the bowel. So as soon as you penetrate, you're going to get the fluid out, and then you stop. And then
okay.
get the fluid.
And so I can tell how deep it is by looking at my measurements.
Centimeters. So each point there on the right hand side is a centimeter.
So
you're going to be just 2 centimeters and you're going to be in the fluid already.
Okay. And that is right below.
So cut where I'm afraid to eat.
Right here. So your olden markers right there is actually right below it. Okay.
So what we're going to do is we wipe the gel out. You're going to clean up the area. You're going to use a sterile kit there. We're going to go from there.
Yeah.
So tell us a little bit about what's going on. We met you 2 weeks ago, and what did we do?
You went in me with the big old needle to take out all my fluids, and you got 3.5 liters out. Yeah, and I felt better, didn't I? Got real skinny, but then they said it would build back up in a week or two, and it did. So I'm miserable. I guess I gotta be this way from now on.
Well, that's the thing. So your liver is not making enough protein to keep fluid in the vascular system. So eventually it leaks, and it leaks into your abdomen, creating something called ascites, free fluid in your abdomen. Sometimes that fluid can become infected, and we call that spontaneous bacterial peritonitis, which can fever, elevated white count, severe abdominal pain. We don't think you have that. I think you just have too much fluid.
Yeah.
And ideally, you get that removed every time it gets too big. But what's too big is different for different people. Just about less than a month ago, I removed 10 liters.
10 liters.
You heard that story, yeah, I told you last time.
10 liters.
So the other person I did a couple of days before that was 8 liters. So some people can tolerate a lot of distension and do okay.
Yeah.
In your case, 4 or 5 liters, you feel so taut because you're a lot smaller than you were. So you get really tight and short of breath. You can't breathe, you can't eat without feeling that distension and issues. But it's not dangerous. It really isn't, unless it gets infected, or unless it's so severe that then you start getting swollen in your legs, you get swollen in your lungs.
Sometimes it does down there. Every once in a while. Yeah, if I get real swollen up in here and turn yellow and all that, then.
Right. So,
but God, that's awful to live like this.
Right. So sometimes they'll set you up so that you go every 2 weeks somewhere to outpatient and get it done, or sometimes they'll put, I actually never seen one, but a permanent port. They just leave a little thing tied up to your skin, and then you just access, drain the fluid out, and they can do that every week or two. It's basically a little port to drain that fluid out. But that's also poses certain risks, because now you leave a hole, it can leak, it can get infected. So you don't just want to jump and do that right away. You want to try to treat the liver problem first before
That's what the gallbladder man told me.
Right, but that's
You
the
said I leak
surgeon.
out,
They
I
can
just
take the gallbladder out. They can do surgery, but this is not a surgical problem. This is a medical problem with your liver.
But he told me he couldn't take my gallbladder out. Yeah.
So start in the middle first.
Yeah, you do your little circle and around.
Can you take that hand
Your
and
hand
move it
up
up
like
there?
this.
Thank you. Tab it.
What are you gonna do? Pin me?
Same thing as last time.
So right now I'm just cleaning you
Little
with
spot right there. You go.
the Chlorasep, which is basically an agent that takes all that bacteria that's already on your skin, because we all have bacteria on our skin, off, okay? And that's to make sure that we don't get your site infected at all.
Okay.
So that it sticks to the skin.
I don't remember that one.
You don't?
Yeah,
No,
we
did.
used
did
it.
It's just to keep the area nice and clean.
The long
So don't
side
touch
goes this
any.
way?
It doesn't matter.
Don't touch
But
nothing.
the longer side goes to the bottom, so you have more of an apron effect. The longer side. So there you go.
And so, remember, keep your hand
Don't
off
touch the
that.
glue.
Yeah,
Don't touch it all.
that's all right.
It's sacred ground.
Okay.
That you can leave outside. I'll get that. No, don't worry.
Just-
I'll get that
okay.
prepped and ready. What else we got? That we won't use. You can put it to the side. That's for the stroke ultrasound, but we don't
No.
need that. We already marked our spot. That's for the end. That you need. So first thing is the lidocaine. So regular syringe, 18. And then there should be a lidocaine inside of it. There you go. Nice. Draw everything, just 10, 11 cc's. Thank you for letting us participate and record this video.
Yeah.
A lot of people learn from doing this, and
Yeah.
they ask a lot of questions about
Mhm.
why we did what we did, how we did it, and things like that. And then the more you watch it being done, when you go to do it, you're ready, you know.
Yeah.
Miss Starr, she's a nurse practitioner student, so she saw us do that one,
Yeah.
and now she's getting ready to do one.
Yeah. Good. Good.
There's a adage in medicine says, see one, do one, and then teach one. That's all you need, just one.
So,
So first things first, you're gonna take this one, and you're just gonna numb the skin at the spot that you showed before.
Yeah. You gotta numb it.
so remember, you're full of pinch and a burn, okay?
I know.
So you do superficially, just like a little flare of the lidocaine.
Almost like a bubble.
Yeah, just like a tuberculin kind of thing. And check maybe a cc's worth.
Okay.
And once you're there, you can pull out, completely out. And then now you go in the same spot, but you're going to go perpendicular. And as you pull, you push in, you pull back and push. Pull back and push.
To make sure
pull
I
back
don't
and push
get
until
fluid.
you get to the yellow fluid coming into the syringe. And that's how you know you're in the acidic fluid.
Pull back.
And push. And then going deeper and pull back and push. And then make sure you're basically numbing each layer as you go in a little deeper every time. And the more you put in, the more numb it will be. Okay, I'm going to push some more.
You doing okay?
Mhm. Yeah.
Should I be getting fluid?
Yeah, but sometimes the needle is so thin that you
That
don't.
I can't pull it out.
So it's fine. I would keep pushing. Yeah. Give one last pulse if anything comes out. All right. Just as you come out, keep pushing on your way out, pushing on your way out. There you go. All right. You make sure you cover that sharp. That's the correct technique to recap. If you are going to recap, normally you don't, but sometimes they have this little sticks and you stick it in, but you don't have that there. Okay, so next you're going to take the blue, and the big syringe. And then you're going to have your blade ready also, because what happens is, I don't end up using the blade, but you might have to.
I think last time you did.
Yeah, no, she has soft skin. Some people have really, really harsh skin, and it just won't go in. But if you can just kind of basically move that little plugger, pull it out, syringe in. Alright. Again, you're using the same track, the same spot. Basically, this time, as soon as you enter skin, you start pulling out of the plunger until you get fluid out.
Okay.
It's numb?
You feel that?
Okay, keep going.
So
you see those little holes on the side of the white thing? They need to be completely inside.
I felt that a little bit.
Yeah, pressure and maybe a little break. Keep going, keep going. You have to get release.
Yeah. That I felt. Yeah. That I'm feeling.
I'm starting to get it there. So, there you're starting to get fluid. So, you're in the spot. So, now it's kind of like putting an IV. You're going to release the knob. Then you're going to float the guide wire in. Just like you would do with floating an IV in.
Release this.
Okay, yeah. And then the white thing you push all the way to the knob. You might want to grab it closer to the skin because it's a long white thing. You're just floating it just like you float an IV.
Ooh. Should I feel resistance?
I mean, some from the skin, but...
Ooh, that's...
Your needle should be coming out. I think you can pull out the needle completely. Just go ahead. Go ahead. Yeah. Alright, put the needle safe here. Okay. Now go ahead and push that all the way in. You might have to wiggle it around. Yeah.
Okay.
Now we just have to hook up the connector. That's still sterile somewhat, but right now we should. I would try to push it all the way. Just try to wiggle it just like you did. All the way to the knob. Yes, yes.
There we go.
Good job, Star. So now you can open this up. Now we're going to hook up the suction, so continuous suction on. It's cool. This goes to here. And then the cable goes to here. So I can handle the blue one because that doesn't have to be sterile or nothing. That goes to the suction.
Do I lock this first?
No, you don't have to.
Okay. So I
Because we don't need samples and stuff. We already
screw this automatically on here.
And there it goes. It should be. Now last time we had trouble with it being positional a little bit.
Yeah, we had to pull it out a little bit.
So you might have to do that again. Don't pull it too way out. Sometimes just a little wiggle. Go ahead and push it in a little more. Alright, so we actually, we found out that the reason it wasn't draining was because the little white part was kinked inside the skin. So as it came into the skin, and before we pulled out, basically we started pulling out too soon. And so as we pulled out, it kinked underneath the skin, so it wasn't letting the fluid run.
Okay.
So we pulled it out, replaced it into the needle, and reintroduced it. This time we went a little deeper before we started pulling out.
Okay.
And now we're getting a constant good flow of that. It's a little bloody because obviously the catheter being there and not draining anything, created a little more reddish kind of
Did you
fluid.
get liquid?
Oh yeah.
God, I hope be glad to feel better.
Yeah, so just gotta wiggle it a little bit.
It seems thicker this time.
It was thick the first time I did it. Over there, right here, hospital. It was real thick and it took forever to get it out of there.
So you haven't been told why your liver's failing then?
No, I was told 5 months ago. Didn't
really?
know it.
So have they done any testing to see?
A lot of it. Yeah, Dr. Terry, he's got
Is it
everything.
cirrhosis?
Yes, cirrhosis.
Okay. And do you know, is this from previous alcohol or from a virus or?
Alcohol.
Oh, it is.
Yeah.
Okay. Yeah. Once the injury is there, you can't undo that injury. You can't undo the damage to your liver. You can manage it. You can improve it somewhat, a little bit, or stabilize it.
They got a new medicine.
Right. There's medicines to
But he
make
won't give it
symptoms.
to me.
You're right. It looks cloudier.
Yeah, it does.
So we might need to send it out. We have enough here to send it. We'll just use that. That's there because that's
Okay.
a sterile sample.
Yeah, that's a lot more.
That in the
thicker,
bucket is
I
not.
think,
But she doesn't have fever or chill, so I don't think it's infected.
I'm just cold nature. That's it.
You have what?
I'm just cold all the time.
Cold all the time. Yeah. And then that's that. Now we'll see your fluid get down and belly get smaller, and you feel better.
Yeah.
So remember, the important thing here is, I mean, we don't mind. We're here to take care of you.
Right.
And we're here to do it. But if you would have caught any of the other ER doctors, they would have not done this, because they would have said, "This is not emergent. We're busy. I'm not doing it," and they would discharge you, because it's truly not an emergency to get this drain in the ER unless it's so big or you're in distress. So they would try to set something up outpatient for you, but I'm just saying. You should definitely talk to TR about maybe getting something set up every 2 weeks or as needed, where you have an open prescription and you go to the outpatient center and get this done.
The outpatient's right across over there, yeah.
I think it's
They gave me a bunch of
Right.
fluid one time.
yeah.
Put in me before I
Sometimes we have to like massage your belly and see if we can get it flowing again.
yeah.
See,
Okay.
there you go. One thing I do sometimes is I as the fluid's coming down, as we change some of these, I have them lay down on their side,
Turn a little bit.
and that brings
Yeah,
the
they
fluid
did that
from one
too.
side to the next, and then you can get a little bit down.
Now, do you want me to lock it from here?
Yeah, well, no, you're gonna lock it over there, all the way at the end there, and then you change the canister.
What stage I am in.
So that's the first one, and you're right, it doesn't look as clear as the other ones look, very much cloudier. And then we're on the second one here. So Ms. Starr, are you ready next time all by yourself?
I think so.
All right. Like I said, she's a nurse practitioner student working with me this month. What, 2 months, 3 months, a quarter?
Yes.
Yeah.
She was very nice last time.
Good.
I tried.
Well, now she saw one, she did one.
She
Now
did
next
good.
time she's good to
It
go.
stuck a little bit, but hey.
She was just practicing her sim simulator. She has to do patients on the computer, simulates live patients,
Oh,
and then she's got
that's funny.
her live ascites sim.
Oh no.
Now it's okay to touch, because now she does know that she's not sterile. She's
Yes.
not gonna pull on that.
This
white
hand
glove
is not
anymore.
sterile.
Well,
That hand is.
just assume both are not sterile
Okay.
anymore, because all we're gonna do is pull out. We're not gonna pull anything back in.
Okay.
So it's okay. It's going. It's not going very fast, but it's going. Now this one's already has the salts on it to solidify. That's why it's making a lot of foam, and it'll turn into a semi-solid substance that's easier to throw away. There was an article in the news that they did analysis of water in major cities, and the water has acetaminophen, ibuprofen, psychiatric medicines, chemotherapeutic drugs, all that stuff. People throw in the toilet, and it goes in the water. So it has microscopic quantities. You know, it doesn't mean that it's enough to make it. But imagine you're drinking water with all kinds of
What
narcotics.
state is
in
this in?
it. Major cities. They didn't list, but it's probably New York. You know, big cities,
Big
Chicago.
Well, you know, they, it's weird that you say that, because that's what they suggest that we do with different medications.
Right,
Put them
right.
down
I
the
was going to
sink.
bring that up next.
Yeah.
So just recently we had a QRS survey, which is this agencies come to check how we do things, and they're recommending we dispense propofol directly into the water source. And the anesthesiologist is like, well, that doesn't make any sense, because propofol does not biodegrade, so it gets diluted. But propofol is the same medicine as Michael Jackson's milk juice that he sedated himself and died with. So imagine that being in your waters and you're drinking, you know, you're swimming in the river and there's propofol in it.
You can't trust
I mean, not enough for you to get sedated, but there shouldn't be any in there, you know. Is it going?
Yeah.
Oh yeah, it's dripping.
So you're getting more out.
I think last time we did what, 3 and a
and a
half?
Didn't you send one little tube off?
Yeah, we did. You want to start kind of slowly tilting yourself to the side. It'll help some of that
to my
fluid.
way.
Yeah.
Okay.
Just really slowly.
Yeah. It's way up here. I thought I was gonna have like, after
Something
eating.
just happened. Oh.
Can I help you?
Oh, we're good, thank you.
Oh, the cord fell
The
out.
cord pulled out of the wall.
Call.
So is it? Yeah, it's falling back.
I think it's flowing a lot stronger than it was last time. So that's the thing. You just got to communicate. Even if you still want to go to the doctor in Rome, at least you know I have to get in to see the doctor, you know.
To see
Correct, to get this done.
Instead of coming here every time.
That's right, because Dr. Carlo may be on vacation or you know something, and you come here and then you don't get it done.
To be gone.
Oh well, yeah, that's true. But I can only do what the person here will let me do.
Supervising. Like I said, most of our doctors wouldn't do this.
You had another lady in here last time too.
With it?
It was 3 of you.
That was the nurse.
Oh yeah, that was a paramedic student and
yeah,
an EMT or something like that. Yeah, yeah.
I was gonna say no, it wasn't another lady. It was me with straight hair.
Yeah.
Oh, we're almost up to the 5th then.
Yeah. Yeah, last time I think you were.
But I knew you wouldn't be here on the weekend, so.
Well, that's not entirely true. Like, I got a long weekend coming up in a couple weeks. I'm working like
Well, I ain't gonna bother
5
you.
nights and weekends in a row.
I won't bother you.
We're here to help. It's what
Well,
it's what we do.
Yeah, you've been a big help. You've done great.
So I'm gonna call her off. If you want to finish up, get as much as you can, pull back, never pull back in, start. And as you pull back, then you drape it, cover it. Be careful with all the sharps. Whatever is on that syringe, put it on a specimen cup, and we'll get that sent out just to make sure.
Okay.
I am here to tell you about Meta 7. Meta 7 combines 7 vital nutrients that boost your metabolism. These essential nutrients boost your energy level and may even help you lose weight. The goal of Meta 7 is to help you activate your life. So if you are feeling a bit sluggish and want your energy back, try Meta 7 today.
Hey guys, Dr. Gilmore here. Thanks for watching our videos. If you like pimple popping and you've always wanted to do your own pimple popping, we've got just what you need. Super Pimple Popping Kit. It has everything you need to get the job done right. The instructions for getting your own Super Pimple Popping Kit are in the video description box below. Thanks again for watching.